Hello and welcome, everyone. Thank you so much for joining us for our webinar today on natural approaches to anxiety and depression. That's presented by Dr. Jennifer Bunsenmeyer. It's a topic I am sure we can all appreciate is timely and so necessary. My name is Dr. Navneer Nibber. I'm a medical advisor with AOR, and I'm going to be your host and moderator for today's presentation. So before we get to it, let's go through a few housekeeping items. We'll get those out of the way. If you'd like to ask questions, you can do so throughout the presentation by typing into the question box on the control panel on the right-hand side of your screen. There is also a Q&A session just at the end of the presentation, so do not fear if it doesn't get answered right away. We will certainly get to it. And please note that the presentation is being recorded for future distribution, and the content of this webinar has not been evaluated by Health Canada or the FDA. It's educational in nature and should not be taken as medical advice. So we always recommend you consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. Any of the supplements mentioned today are not intended to diagnose, treat, cure, or prevent any disease, and the opinions of our guests and host may or may not reflect those of Advanced Orthomolecular Research, Inc. Okay, now that that stuff's out of the way, we have the remarkable Dr. Jennifer Bunsenmeyer presenting today. And as a naturopathic doctor, she's committed the last 12 of her 16 years practicing as a naturopathic doctor to supporting mental health of our patients, recognizing that multifaceted and complex nature of anxiety and depression. Dr. Bunsenmeyer is passionate about passing along the impactful knowledge in treatment options for anxiety and depression and finding that missing link to a growing epidemic, filling in the gaps that exist in our current conventional treatment options of antidepressants and therapy to spread the word of natural treatments. She's built a very prolific network of health professionals in Calgary, including psychologists, to really work as a team to triage and have patient-centered approach. She's published various articles on mental health in CAND's Vital Link, Anxiety in the Multi-Professional Treatment Approach, and demonstrating how that collaborative approach is so important. So without further ado, I will pass it over to Dr. Bunsenmeyer. Thank you so much for being here.
Thank you, Dr. Nibber. I'm really excited to present this information. Thanks for the great introduction. Thank you, everybody, for making the time to take out of your busy schedule. I know we're super busy in practice now, and so this is a really important and a topic that I hope that we can spread more info to people. So the goal of my talk today, we're going to first look at triggers and pathophysiology of anxiety and depression, and then we're going to go into assessment of how we can assess as naturopathic doctors or functional medicine practitioners. We're going to cover a little bit about menopause and hormone health and how that can affect our mental health. And then we're going to look at nutraceuticals to help manage that anxiety and depression, a little bit on hormonal aspects as well. So my intention for this talk is, like Dr. Nibber said, is I've really had a passion in my practice to work with anxiety and depression. I discovered back in the late 2008-ish, there is a area of treatment from a conventional standpoint. People know about antidepressants. They might know about therapy approach, seeing a psychologist or a counselor. But what I discovered is there's this whole area of natural medicine that can bridge the two together that we can support and deliver to people. So it's been a real passion area. So as I was prepping for this talk, I really wanted to deliver to you guys all my clinical pearls that I've gathered over the years. That's what is going to help support us as NDs, getting information out there of what's worked for us in practice. So I'm hoping I can pass that on to you guys as well. So my approach with patients is, number one is meet the person where they're at. So with depression, a depressed person, it's really going to be hard for them to take gluten and dairy out of their diet and change their lifestyle from the get-go. So it's really looking at what are the small baby steps so we can help support our patients. We're wanting to blend lifestyle changes with nutraceuticals. And the whole point is we want to have a paradigm shift. So we can sometimes be in our society in that paradigm of, I go to the doctor, they give me a pill, I get better. And so instead, what we're trying to do is I want to teach people, how can I blend lifestyle changes? How can I change my thought processes? How can I recognize my thought processes? And what diet and lifestyle and nutraceutical options are there out there for them, that they can have tools in their toolkit to help support them. So really, we're trying to teach them how to be accountable for their health. So here is the mental emotional piece from a psychologist perspective, social worker, therapist perspective. I'm always referring out. I have, like Dr. Nibber said, I have a network of psychologists that I work with. I'm in Calgary in private practice, and most psychologists are in private practice, and we work back and forth. We're basically working as a health team approach, basically. Life coaching, self-development work, mindfulness meditation, yoga, qigong, EFT, just giving them that support from that mental emotional piece as well. I am very middle of the road in terms of not one extreme or the other. I like to integrate natural medicine with where the patient is at, whether that be they're on conventional medications and we're supplementing in with that, or they're coming to me first before they try conventional medicine to work on things prior to. So wherever the person's at, I am there to respect where they need to be and help support them as much as I can. For this talk, I'm a clinician and a naturopathic doctor, first and foremost. I have a very scientific mind, very analytical mind. I love analyzing the research and analyzing different things that can help my patients, but I'm not a research scientist. I don't pore over the literature and look at the p-values and everything from that perspective. So my talk is really geared towards what can I deliver to you from a clinical perspective, and giving you the information that I've gained over my years in practice. So let's look at anxiety triggers. So and some of these overlap with depression as well, as you'll see on the next slide. So we, as functional medicine practitioners and NDs, we definitely would be looking at diet, looking at how are they balancing their blood sugar? Are they going into hypoglycemia? Is there a stress or adrenal component that is potentially increasing their cortisol response, and that is causing anxiety, or is it decreasing their energy, and that's part of the depression? Hormonally, is there a dysregulation? Is there PMS? Are they in that perimenopause stage where progesterone is starting to decrease? Are they in that menopause stage? So we're going to look at that as well. Looking at vitamin mineral deficiencies, low neurotransmitters, serotonin, dopamine, norepinephrine, and how I want to give you a good clinical parole and how low stomach acid can affect neurotransmitters as well. Essential fatty acids, we're always looking at that as well. And then we're going to look at that gut connection, food allergies, intolerances from the inflammation perspective. That leads nicely into depression triggers. We definitely are going to look at that gut-brain connection. So now in psychiatry, they do recognize that there is an inflammatory response in the gut and how that can affect the brain health. We're again looking at stress, hormones, low neurotransmitters, low stomach acid, just like anxiety. There could be predisposing conditions like hypothyroidism, so we want to make sure we're ruling out that as well. There's definitely a genetic piece from an anxiety depression piece, but as you can see, there's all these lifestyle things that we can help support as well. And then that psychological, mental, emotional piece that I work with therapists on as well. So let's get into, don't we always as naturopathic doctors talk about the gut? So we know that the gut is like, we call it the second brain. So it has a major role in neurotransmitter production. 80 to 90% of that serotonin is produced in the gut in the enterochromaffin cells. Inflammation has been associated with depression. So we know this now. This information really started coming out about 10 years about that mental health perspective. And so part of the mechanisms is increased inflammation can decrease the absorption of tryptophan, leading to a decrease in serotonin in the brain. Furthermore, inflammation increases what's called the IDO enzyme that prevents conversion of tryptophan to serotonin. So the more inflamed we are in the gut, the less ability we're going to have to make serotonin. So as naturopathic doctors, functional medicine practitioners, food intolerances will definitely play a factor in that inflammation. So if the gut is irritated by that food, or if there's a microbiome imbalance, like SIBO is very small intestinal bacterial overgrowth, this can increase inflammation. And serotonin is actually released into the gut to increase peristalsis so that that gut can get empty because it's irritated. Furthermore, if we get that inflammation and we get those inflammatory cytokines, those cytokines can go to the brain, and then that can create an inflammatory reaction. And this is the link in terms of why fish oil works, why turmeric works for depression. So as practitioners, we can be looking at IgG sensitivity testing. We can be looking at an elimination diet to help figure out what foods are affecting that inflammation in the gut. But then as NDs, we all know that there's more to it than just food intolerances, that there is that SIBO connection, how they're digesting, digestive enzymes, liver, bile flow, all of that. So naturopathic therapies are aiming to decrease that inflammation so that we're not having that inflammation in the body and the gut. And we're going into all of that where we excel. This is an example of an IgG food test by Great Plains. There's Rocky Mountain Analytical does this test as well. There's many different labs out there. And these are more common food allergies, which I know that we're all very familiar with as practitioners. Now let's focus on assessment. So let's look at testing that we can potentially do. So first line tests would be looking at lab work, ordering a CBC, TSH, folate, vitamin D, B12, all those things listed there. Some clinical plurals I've learned is 2013, I went to a conference in Chicago on mental health. James Greenblatt spoke. He's a medical doctor. He's written some really good books on depression and eating disorders. He cited in one of his lectures that studies showed that people that have low folate have I think it was 43% increase or 43% chance of having a relapse in depression once they come off their antidepressants, versus if their folate is fine in the blood, there was only a 3% chance of relapse and depression. So that's made me test folate, and just to make sure I'm not missing from that perspective. Vitamin D, we know that immune system and vitamin D is really important from a mental health perspective. B12, I like to see at the 500 to 600 range. Greenblatt is actually the one that I learned that from. That's where he likes to see that range be at. Usually reference ranges anywhere from normal would be 155 to 700. So, but when they're at 155, 160, they are tired. So depression definitely can be triggered from that perspective as well. CRP, ESR because of that inflammation aspect. More specific testing would be urine methylmalonic acid, MMA for short, to assess tissue vitamin B12. And the Dutch test in their Dutch Complete has this in it now. We could look at red blood cell magnesium, plasma homocysteine in terms of the B6, 12, and folic acid aspect. If we wanted, we could look into neurotransmitter testing. ZRT Labs has a neurotransmitter test to get further information. IgG testing I talked about. And then if we're looking from the hormonal aspect, Dutch test through Precision Analytical has a really good, their Complete has the hormones, plus then I really like it because it has the organic acids aspect. Which gives us information about dopamine, norepinephrine, epinephrine, which is important for depression and anxiety, and melatonin from a perspective of sleep, and then that MMA for the B12, and it also tests B6 as well. So that's just a little bit about assessment aspect. Now let's look at stress in a person's lifestyle and how that can affect anxiety and depression. So stress, as we know, increases that sympathetic nervous system. That can cause a chronic increase in cortisol. So we can get a higher amount of anxiety. So stress will definitely trigger anxiety, insomnia, a decrease in appetite, even inflammation. If a person's as NDs, we're definitely looking at adrenal function. And if a person gets into that adrenal exhaustion place, or now we call it adrenal dysregulation, that can definitely affect depression. So I often look at adrenals and support adrenals for depression, which we're going to look into lots today. Stress impedes digestion, so it can increase that colonic motility, it can decrease gastric motility, and then our gut is not working well, and then that can create more inflammation. So making that connection from the inflammatory aspect. And then stress leads to a decrease in tryptophan absorption and an increase in inflammation. So this graph is looking at basically, this is how I teach patients about what's happening when we have those thoughts that are triggering that anxiety response. So when we have a what if thought, oh my gosh, what if this happens? Adrenaline's released and it spikes up. Your body's really smart and it starts to break it down within 5 to 10 minutes. So it does start to decrease. But if we have another what if thought, it's going to spike up again. And then it's going to start dropping. But what if this happens? And so when we're in this anxiety place and someone has that high anxiety brain hamster wheel thinking, they're going to not allow this adrenaline and that cortisol to calm down. And so they start living in this place of higher cortisol. And so their cortisol levels, instead of being down in the baseline where they should be, they tend to be living up in here where the cortisol and the adrenaline is really high. And that's just going to continue to perpetuate that anxiety. So our treatment goals is to help calm down that cortisol by looking at that lifestyle, mental, emotional piece, nutraceutical piece. So this is where I'm working with a therapist as they're working on the mental, emotional piece, and then I'm giving nutraceuticals, which we're going to get into a whole bunch of different things we can use for anxiety to calm that nervous system down. as the therapist is working on that thought process aspect and teaching them how to manage those anxiety thoughts so that they can talk themselves out of that anxiety and that adrenaline starts to calm down. So this is a combination of, yes, our nutraceuticals can calm the nervous system, but we don't want to be depending on pills. We want to also change our thought process to a different way so that we can be managing those anxiety thoughts so that they can feel calmer, so they don't need the nutraceuticals. And so that's the ultimate goal. So that's summarized in this slide here. So with those increased thoughts, that cortisol increases, we get a new baseline of cortisol. If they're managing the thoughts, that cortisol decreases. But conversely, we can use calming supplements and herbs to decrease that cortisol enough so they can work on controlling those thoughts. And so the feedback that I get from the therapist is that the more they're working with the things that we're doing, they can actually do that work to calm that anxiety brain down. It's a little bit easier for them to recognize the thought, be aware of, yes, that's irrational, and talk themselves down so that they know, okay, no, it's normal. And then eventually the goal is that they have the fleeting thought, it spikes up, it's fleeting, and then they just let it go. That's the goal of treatment. So this summarizes a little bit of that as well. So stress will have a huge effect on anxiety. It triggers that adrenaline. If the adrenaline increases over time, we get that new normal of adrenaline. Stress is part of the worry. So the more stressed they are, the more they're going to have that adrenaline spike. But it's our thoughts that generate this worry. It's our what ifs. It's our perception of those thoughts that trigger that adrenaline response. In the coaching world, we call this our saboteurs in ourselves. It's our judge inside who is telling us what we should be doing. So the more we let those thoughts go out of control, the more cortisol we're going to stimulate, the more anxious we're going to get. But if we can manage these thoughts, the cortisol can be managed. We can use natural remedies to help manage the cortisol, things like Relora, phosphatidylserine, theanine, passion flower, tilia, herbs to calm the system, so we can intercept these thoughts easier, bring the awareness to them, and then practice talking ourselves down from the what ifs, the shoulds, the negative self-talk. That's the goal. We're trying to marry the two together, working on the thoughts, working on that mental emotional piece. What do we have in our toolkit to help calm those thoughts, calm that adrenaline down? From a depression standpoint, they're already feeling tired, they're having muscle tension, sadness, those are prominent. Stress will just increase this response. So it's stress, and our perception of the stress again causes us to tense our muscles, expend energy in dealing with the stress. This to a depressed person causes them to get drained even more. Their enhanced tiredness, more muscle tension, decrease in interest, decrease in motivation to do the things they want to do. So stress can fuel or lead to our depression. So as NDs, we can support those adrenals. So things like adaptogenic herbs like rhodiola, Siberian ginseng, licorice, vitamin C, we know those tools in our toolkit. We can help support that depression from that perspective. So this is looking at, okay, what are symptoms of adrenal dysregulation? So we would definitely do our assess for orthostatic hypotension. So doing blood pressure, lying to standing, seeing if it's falling when they stand up, seeing if it's spiking too high, indicating they're in that high cortisol place. Looking at tiredness, dizziness, hypoglycemic reactions. We can do saliva urine cortisol testing. Addison's disease is severe. Hopefully we're not seeing that in our office, but this is what we're looking at it from an adrenal perspective. So now let's shift gears and let's look at a little bit about hormones. So again, what I'm trying to do is look at, from a naturopathic perspective, how can we work up our patient? What are the different areas that we want to be looking at that could be triggering this anxiety and depression? So we can then pick from our toolkit. So let's look at hormones. So we're assessing for menstrual irregularities. So is there PMS there? Are they getting irregular periods? Are they getting short cycles indicating low progesterone? Are they in that perimenopause or menopause stage? That will, if we look at the hormonal aspect and we treat there, that can help the anxiety and the depression as well. So here's some tidbits in terms of hormonal connections. So we know progesterone is anxiolytic. So in our 40s, progesterone is usually decreasing first before estrogen. So there's definitely an association with anxiety and insomnia. So we definitely want to assess progesterone. And on saliva testing or urine testing, like through Dutch, we can look at that progesterone versus the estrogen. Is the progesterone reference range, are they at the lower end versus estrogen, they're at the higher end or elevated? Menopause, there's a 14 times higher risk of depression around menopause than in the 31 years prior to menopause. Yep, it's kind of depressing being in my 40s. But what I'm thankful for is that we have the tools from a naturopathic perspective to help support these women. Estrogen, so here's the little pearl and connection. So estrogen supports serotonin levels by decreasing that enzyme monoamine oxidase. So that enzyme breaks down serotonin levels. So as long as we have enough estrogen, it's going to inhibit that monoamine oxidase, and then we're not going to break down our serotonin. But as soon as estrogen decreases, then monoamine oxidase is going to increase, and we're going to break down more serotonin. So that's why Bongiorno in his book on depression has said that estrogen replacement is shown to alleviate depression in menopause. Makes sense. So from a hormonal perspective, we're definitely looking at thyroid as well. So if they're getting symptoms of hypothyroid, we all know what those are, but they're listed there. We would definitely look at from a TSH perspective. I like to see TSH less than 2.5, or I even look at previous TSHs, and if they're always like hovering 1.07 and all of a sudden they spiked up to 2.4, and they're having symptoms of thyroid, we have tools in our toolkit to support that thyroid before it gets to be under functioning in that 4 or above range. Okay, so now we're into the fun part of our toolkit. This is what we do as naturopathic doctors. So we're going to go over the last half of this talk is just looking at things that we can help support them in their lifestyle supplement-wise to help give options from an anxiety, depression perspective. So we're going to look at diet, we're going to look at adrenal, stress, cortisol support, and then we're going to look at specific herbs and nutritional supplements for depression and anxiety. First, we're going to look at that collaborative approach working with therapists and naturopathic medicine. So therapists can do very many different techniques. I just wanted to remind you of different types of therapy. So there's cognitive behavioral therapy, or CBT for short, exposure therapy, which is actually really good from an OCD perspective. Psychodynamic therapy, psychotherapy is more looking at, I'm not going to do this justice as I'm not a psychologist, but it's looking at that like more past, what is triggering them, what does this relational therapy is looking at, how is this relation triggering something from previous relationships, or how are they in relation to other people. So as the clients are working with their therapist, I teach those patients how to use natural remedies to help calm their emotional reactions, and as they're changing their perceptions, to enable them to do that deeper emotional work to get stronger and manage through that anxiety or the depression. So It takes a lot of energy to manage anxiety. So if they're exhausted, it's going to be hard for them to go out into the world and manage through that meeting that they're nervous about, because they're already tired because of the anxiety or because of stress. So what do we have in our toolkit to help with that? Along with advocating for them that maybe they do need to rest more, maybe they need some downtime. So really, again, meeting them where they're at. And from a depression standpoint as well, they need that energy to look at it, perspectives, thought processes a different way, to change their perspectives, to have enough energy to get out and exercise or do the dishes and do some chores around the house. So that's where we can use our toolkit to help them from that perspective. So again, what we're trying to teach is a different paradigm of healthcare. So it's not just about taking a pill and getting better. It's how do they need to manage their thoughts? What do they need to do in their lifestyle? How can they change their diet? What brings them purpose? What brings them, what's their core values, so that they can create the life that they need. But we're using things to help calm them or give them energy to do that. So this work, it's work for clients and it takes time. So it's educating them that yes, it's going to take time. This is a different way that we're working. But the rewards are they're creating the life that they want. They're getting out there and they're doing what they need to do. They're learning the skills to manage the anxiety so that it's a fleeting thought and then it goes away. So that's the goal of what we're trying to do. Just some information in terms of combination of psychotherapy and pharmacotherapy, like antidepressants, have shown positive outcomes with panic disorder, OCD, and major depression. So we know that therapy and some type of antidepressant type of work does make a difference. I haven't found research that has studied the effect of natural supplements in psychotherapy, but I have totally noticed positive effects using the combination and working with patients who are also working with therapists as well. So I know that it does work. So again, our collaborative approach with therapists and also with medical doctors, because if they're needing antidepressants, they need those, but there's still things that we can do with that. We're teaching them how to use supplements or lifestyle things. So diet, sleep, all of those things. If we educate patients on the appropriate use of those calming botanical tinctures or nutritional supplements such as L-theanine, as they participate in that counseling work to help manage the anxiety, we've developed a successful integrative healthcare team approach. So we're teaching them to build their toolkit. We can empower patients to develop that toolkit with a supplement and diet plan that addresses their nervous system, perhaps enhances serotonin or other neurotransmitters like dopamine. Maybe we need to manage their nighttime sleep that supports their daytime energy so they can manage that anxiety and the depression better. So it's always looking at teaching them, okay, where do they need to look? What is off that they need to support? And so when I work with clients, we build this toolkit and then they come in and they go, oh yeah, I was anxious, so I added some L-theanine back in. Or they start to learn what they need when they need it. Or, oh, I was anxious and then I realized I went to the movies and I ate a whole bag of candy and I was depressed for 2 days afterwards. So they're starting to put those light bulbs on that diet plays a factor, exercise plays a factor, and they're building and they start to learn how to use these different supplements that they've used in the past as well. So in terms of diet, we're definitely looking at, are they having that reactive hypoglycemia, where they've had too much carbs, too much sugar, not enough protein, and 30 to 90 minutes after their meal, if they're shaky, weak, fatigue, sweating, lightheadedness, excuse me, brain fog, they've probably had too much carbs, not enough protein. So I start to teach them how to adjust their meals so they're half plate non-starch veg, quarter plate protein, quarter plate starch. But for a depressed person, that might be way too much. So we might start with, let's just make sure you're getting protein, breakfast, lunch, dinner. Let's make sure you're eating 3 meals a day because they might only be eating 1 meal a day. So it's, again, meeting them where they're at, because if we overwhelm them too much, we won't see them again. And so it's small steps, small baby steps to help them do that. So an elimination diet on the first visit for a depressed patient is probably not, they're probably not going to be able to bite that off. So this is maybe down the road where we eliminate possible food sensitivities that they maybe know they have a sensitivity to dairy, looking at those common allergenic foods. So as NDs, we know how to do this. So here's a clinical pearl that I learned from James Greenblatt when I went to his lecture in 2013. So he uses Betaine Hcl with almost all his depression patients because he's noted that most of them have that low stomach acid. So we need stomach acid to break down our protein, to get the tryptophan and the tyrosine to make the serotonin and the dopamine neurotransmitters. So I always look at stomach acid and see if they're low in stomach acid. He also supplements a lot with an amino acid formula as well. So because neurotransmitters are made from amino acids. And then the other clinical pearl is undigested food can trigger that inflammatory response lower down in the gut. And then that's linked to that inflammation aspect and depression. So let's assess gut from that perspective. Probiotics, we know, can decrease inflammation. This study has shown that it can induce neuroactive substances like GABA and serotonin. And rodent preclinical studies suggest antidepressants, and they have an antidepressant and an anxiolytic effect. So a potential for treatment, especially if gut is off. This is a summary slide of different adrenal support that we can use. A note in terms of supplements for adrenals for anxiety, you really have to be careful. A lot of times I will not start with an adaptogen. Even a B complex might be too stimulating for someone who's really anxious. So I might do calming things first, which then take their foot off the gas pedal and conserve gas in the gas tank, which is supporting adrenals. So, and I explain it that way and they go, oh yeah, okay, that makes sense. So routine, number one thing from an adrenal perspective, anytime we're off routine, our adrenals have to work harder. They like status quo as much as possible. So meal times around the same time, bedtimes around the same time, wake times around the same time. Routine is key. Balancing blood sugar with diet. Phosphatidylserine and Relora I find works so well for modulating cortisol production. So I like using this for sleep at night. So I dose like a capsule supper time and before bed. Obviously, I would assess medications before doing that. But I find it works really well for that waking up at 3 a.m. Those adrenals are getting cortisol into the system, but they're just dumping cortisol into the system, and that's causing insomnia. So I find those work really well. We're going to get into adaptogenic herbs. We all know physical exercise, fresh air, nature, adequate rest is important for adrenals. So looking at adaptogenic herbs, some tidbits of information. Rhodiola has been shown to influence neurotransmitters like serotonin, norepinephrine, acetylcholine, and dopamine, and to decrease salivary cortisol levels. So we could maybe use rhodiola during the day to help calm cortisol down. if they're really anxious and if they're in that revved up place, and then maybe use phosphatidylserine at night. One small clinical trial showed its ability to help decrease depression and related symptoms. And then one research study showed that used together with tricyclic antidepressants, it helped reduce medication side effects and also alleviated depression symptoms. James Greenblatt found a small study that showed that rhodiola enhanced SSRI effectiveness. It prevents the reuptake of the neurotransmitters. So we're going to see this on the next slide a little bit more. But before we do, menopause tip, rhodiola inhibits monoamine oxidase. So as estrogen decreases in menopause, we could use rhodiola to make sure that it's inhibiting the MO so we don't break down that serotonin. Good clinical pearl right there. So James Greenblatt, I got this from his lecture, found that rhodiola and green tea can actually inhibit reuptake of the neurotransmitter. And curcumin, quercetin, and our endogenous estrogen actually prevent degradation of the neurotransmitter. So I think it's preventing that monoamine oxidase from working. So those are really good clinical pearls of, like, if we're choosing an adrenal support and we're working with someone with depression, like, this is great. If we can hold that serotonin in the nerve synapses longer, that's excellent. Other adaptogenic herbs, so we all know Withania ashwagandha is really good at countering the effects of stress, helps with changes in blood sugar and cortisol levels. Siberian ginseng can help modulate cortisol as well. And now the next couple of slides is looking at our B vitamins. So B3, B6, B12, folic acid are all cofactors for serotonin production. So they help with converting tryptophan to serotonin. Niacinamide has benzodiazepine-like properties. So that can be a nice calming effect from an anxiety perspective. And then B6 as a cofactor as well. And B12 is a cofactor too. So Abraham Hoffer found this one small study showed vitamin B12 levels in serum were normal, but deficient in cerebrospinal fluid. And those individuals showed neurasthenic symptoms like fatigue, nervousness, irritability, anxiety, depression, headache, and insomnia. So B12 is also a really important one for anxiety and depression. So I will often give a B complex to help support depression for sure. I might give it first for anxiety, but probably not. I just want to see how they respond first with some other things, because I have had 25 milligrams of B6 stimulate anxiety too much. So just really have to be careful with that one. And then looking at the literature out there in terms of fish oil. So low DHA in breast milk has been associated with an increase in postpartum depression. Individuals with major depression have marked depletion in their erythrocyte phospholipids compared with controls. Fish oil has been shown to decrease cortisol levels, so that's another great one for anxiety. But Roma Reina at the Vancouver Mental Health Conference in 2020 in March last year presented a ton of good information on anxiety and depression, and he presented a bunch of studies about fish oil, and there were some discrepancies, and some studies did not show a significant benefit. So the next slide shows what he found. So he found that some studies were insignificant results, but they used low DHA and EPA. So of course those outcomes are not going to change as much. Some of those studies were short studies, and other studies showed positive correlation with helping depression. So I think it's like a good thing to supplement in and see if they respond. So mild to moderate depression, they definitely did notice a difference. So my dose range is anywhere from 1,500 to 2,200 of EPA and 1,000 of DHA. And anecdotally, clinical experience, if I have a female patient who's anxious or depressed post-birth, even 2 to 4 years later, I will give high DHA and it always helps mood. It's awesome for mood. And it's a good one to use when they're breastfeeding and we're limited. We don't want to use maybe some herbs or different things because they can pass into the milk. It's a good one to use for anxiety, depression. I find that it really works. Sometimes I have worked with them prior to pregnancy for anxiety, depression, but sometimes it's first visit and they come back second visit and they're noticing a difference. Magnesium, we know magnesium deficiency is found in ADHD children. It has a calming component. It can help with insomnia, so it can be really great from an anxiety perspective. 5-HTP is an immediate precursor to serotonin, and then it converts to melatonin. So 70% can be absorbed from that, an oral dose. And I learned years ago that it can be enhanced by taking it with fruit or juice to increase the insulin response. But you know, I kind of forgot about this, and I haven't been giving it that way, and I'm finding I get just as good of results. So just letting you know. So I will often start with that one for anxiety and depression. For depression, if they're not responding just with 5-HTP, I might add tyrosine in. I would not add tyrosine in for anxiety. It could cause more anxiety because it stimulates because it's converting to dopamine. Dr. Kalish, I learned from his webinar that he's a really big proponent that if you give 5-HTP, you should also give tyrosine, because he says that if you're driving the 5-HTP enzyme reaction, that's going to drive the tyrosine to dopamine reaction. And so he says that you drain your tyrosine aspect. I haven't done this, and I've still noticed really good results. Like he says that this can be something that this is why antidepressants will work at first, but then they stop working because they're draining that reaction, which may be true. But I find just from the list can get really long from a supplement perspective. And so I will not start on both. And a lot of times that 5-HTP just keeps them well. So maybe it's because we're also working on the gut and they're digesting better and they're getting some tyrosine from their meat. Not sure, but just giving you both sides of it just so you know my experience as well. Note, tyrosine you would not use with an increase in blood pressure because it can increase blood pressure more, or things like hyperthyroid, Graves' disease, we would not want to use it with. So the reason it works is dopamine will help with focus and motivation. So for depression, really important piece as well. So this is just showing how it's going through the nerve synapses as well. Saffron has shown some really good literature has come out about saffron. I haven't used saffron very often, but this study showed a large positive effect size when compared to placebo for depression and anxiety. And it also had was good to use as an adjunct to antidepressants as well. And then curcumin has shown to help with shown to have an antidepressant effect in preclinical and animal studies. So 1 gram a day in MDD significantly decreased depression symptoms. So that's that inflammation connection piece. And this, you can use it alongside antidepressants if they're have been on that antidepressant and they're not wanting to go off, or you can do it alone. So Raina did note in his talk that you need 4 to 12 weeks for therapeutic effect to start to kick in. So just a note there. And zinc deficiency has been shown in literature to be associated with depression as well. So zinc regulates the synaptic transmission for neurotransmitters in the hippocampus and the cortex, Raina had mentioned in his talk. And the meta-analysis showed inverse associations between dietary zinc and depression risk. So in this study, 25 milligrams was used, and zinc supplementation significantly reduced scores in both the Hamilton Depression Rating Scale and the Beck Depression Scale after 6 weeks and 12 weeks. So the mechanism of action is modulation of glutamatergic or immune system. We're almost done. I know we have to wrap up. L-theanine, one of my most favorite calming remedies. Love using it. It is not sedating, so I like using it during the day. It's helps mood modulate, neuroprotective. Comes from green tea, but does not have caffeine in it. And GABA is fast-acting, nice calming effect as well. So unpublished studies show that GABA can decrease salivary cortisol as well. Calming herbs, we're very familiar with chamomile, passion flower as anxiolytics as well. So a lot of combination remedies will have these in them. And then inositol is one of my favorites, especially from an OCD, panic disorder, or eating disorder perspective. Eating disorder perspective because 90% of eating disorders have an OCD perspective. So it helps with that impulse control, which is super important from an anxiety perspective because they're very impulsive because they're in that reactive space of what if, and then they react right away. So it can help with the impulsiveness. So it's also been shown effective for depressive symptoms in PMDD, which I wasn't aware of before I did the research for this talk. Some studies have shown mixed results for inositol with OCD, and Greenblatt did present that as well, but he was like, hey, if it's going to help some of those patients, might as well try it and see if it makes a difference. This study is talking about ADHD and phosphatidylserine, but I left this in here just to let you know that this is something that I use for modulating cortisol, and I find it works really well for sleep and insomnia and anxiety, dosing at night. And sometimes I even use it like at breakfast time if they're feeling revved up about their day. So these are just general things that we can do to help alleviate anxiety that I will discuss with patients as well. And then this would be a common prescription that I would give for an anxiety perspective. So 5-HTP, L-theanine, maybe some Relora. I might stop there. I'd really be cautious about B-complex. I probably wouldn't give it in the first visit. And then let's do some therapy, lifestyle things. Oh, and what I didn't put on here, which I forgot, is teaching them how to balance their blood sugar with diet, and maybe start with protein, breakfast, lunch, dinner. And if they're game to decreasing sugar, maybe, but maybe not even at that visit. So meeting them where they're at. And from a depression standpoint, might start with some 5-HTP, an adrenal supplement like that Ortho Adapt, B-complex with breakfast, maybe some zinc, turmeric. I might look at the gut and see where that inflammation piece is at. Therapy, like making sure both actually with anxiety and depression that they are seeing a therapist, a psychologist to work on from that mental health perspective. And I might do a values exercise. So I did some coaching classes, and I found finding our core values of like what really makes us tick, and then making sure that those are getting expressed in our life are a super important piece of depression, because it gives them purpose. It gives them a reason to get out of bed. And the same thing with anxiety. So I might do a values exercise. So I try to make it well-rounded, that like we're really teaching them how to look from a lifestyle perspective. So that's the end of my talk. I hope you gained lots of good information from this, from one naturopathic doctor to the next. My intentions was to share my perspective from practice on what has worked to help you. So we have the tools together to share and empower people with these things. Let's get the word out and really help support people in their mental health in this pandemic, where many people are needing it. And let's bridge that gap between conventional medicine and therapy options. We have so many tools in our toolkit that we can help support people from an anxiety, depression standpoint. So I hope I've motivated you. I hope that you got lots out of it. And yeah, I'm here to answer any questions.
Thank you so much. That was so informative, and I know I was frantically taking lots of notes, so I appreciate that.
Oh, good.
You brought up quite a few really interesting points, and I think just to start our question answer off, we had a few questions. So when you're reassessing, and particularly when someone is trying to make that decision of antidepressant medications or pharmaceutical options, how are you sort of walking through that? And of course, still being mindful of, scope of practice and things like that. But how do you sort of walk through that with someone?
Yeah, that's a really good question. And so it's basically like it's having a like a heart-to-heart discussion of, okay, where are you at with the anxiety? Where are you at with the depression? And really getting a sense of how severe it is, how much it's limiting their lifestyle, and also then playing that back to them so that they're processing through, well, it's like, I can't leave the house, like it's really limiting my lifestyle. So they have an understanding of the severity of it. And then it like really, I am middle of the road. I'm not pro or against. If anything, I'm also pro antidepressants. If it's really severe anxiety and depression and it's limiting their lifestyle and they're needing something very fast acting. If it's very severe, I know from a naturopathic standpoint, the things that we have in our toolkit might not be strong enough, and I let them know that. And I also know from experience how things like how the 5-HTP responds. Like 5-HTP works usually within 5 to 7 days, they will start noticing a difference. And so, I might say, okay, in 5 to 7 days on this, if you're not noticing a difference and you've been suffering with this for, like if they've been suffering with this for 5 years, they might want something soon. Or if they've been suffering with this for 2 months, but it's hurting their marriage, they might need something really quick. So if that's not helping, then it's about, okay, we've had the conversation, you know that antidepressants are there, and you can talk to your doctor at any point, or maybe they've had the discussion, they have the prescription, they can even fill it. And if the 5-HTP is not enough, they can fill it. I tell them to come off the 5-HTP, and then we're still doing some adrenal support and some other things alongside that. So I try to marry it together, and it's really a discussion, and I'm never telling them what I think they should do because it's not up to me. It's up to them. They know their body best and they know their life best. And I'm giving them, here's the tools that they can do from a naturopathic perspective. Those can be done with an antidepressant, or they can be done before you try an antidepressant, but it's kind of looking at the whole piece. And another piece is if they're suicidal and they have a plan, I think they're at a place where they need an antidepressant, and they need not just me on their healthcare team. They need a psychologist, they need their medical doctor to be there as well. Like we have to be very careful as NDs that if they're suicidal, that is a very severe place to be, and they will probably need more help quicker than what natural medicine can give them. If I It's really hard to answer that question without individually knowing the person, but yeah, you have to be really careful. So I think I'll end it there.
Yes, no, and that actually really addresses it well, because we had a question about, is the goal always to get everyone off the therapies and able to deal with their emotions and thoughts on their own? And I think you answered it very, very well and very clearly, is that it depends, and it will never be you must come off or you must stay on. It is about, that
And it's discussing with them. I am not pro or for or pro or against you staying on your antidepressant. You're here to find out different approaches, but your antidepressant is part of the toolkit that has been working for you. Let's see how you feel as we do some naturopathic things. There's no end goal. It's just day by day. Let's see how you're doing and see where it takes you. Some people come in with, I want to get off. Okay, I can support them in that, but it's not going to happen tomorrow. We need to support you first, and we need to see at that time if you're ready to come off, because what's happening in your lifestyle in your life at that moment. If you're going through a divorce, or even if you're going through a pandemic, it might not be the best time to entertain that. So it all depends.
Yeah, and actually, we have a great question in and around, as you're making these, having these discussions, are you using a lot of those validated questionnaires with helping with the diagnoses and assessment, or how are you kind of are you using some objective or subjective markers? What does that look like?
I think, yeah, that's a really good question. You know what? I should use those. I have looked at them, and it just has kind of gone in one ear out the other kind of thing. At the point that the people are coming to me, like they've been diagnosed with anxiety and depression by their MD or a psychologist, that I'm not even really using that at that point. What I'm doing is every visit, I'm assessing, okay, how is the mood? Where's the motivation? How did it go adding that walk in? How did it go? Oh no, I wasn't able to do that. My energy's been so low. That's how I'm assessing the depression. Or, okay, where's the anxiety now? Is it still at that constant level? Out of 0 to 10, 10 being high anxiety, where is that constant anxiety at? And then I look back in my notes and go, okay, first visit, she was at an 8 out of 10 or a 10 out of 10. Now she's at a 7 out of 10. So I know the therapy is working. And not your, because we don't want to own it for them. How is the insomnia? Are you sleeping better? Are you waking at night still? Well, I'm not waking as much. I'm only waking once a night instead of those 5 times a night, and I can go right back asleep. Then I know the cortisol is coming down. So that's more how I'm assessing, because most people have already had that diagnosis coming to me.
Mm-hmm. Yeah, and that's a great point, is, yeah, they do have that diagnosis, and you already have that relationship with a lot of these practitioners. So we have a question about how you were able to form a lot of these relationships, and how you present a lot of that information to the psychotherapists and psychologists on researching benefits of naturopathic interventions. What did you find was the best approach to make those connections?
That's a good question. I'm so glad that you guys are asking these questions. So I first developed this talk for Rocky View Hospital here in Calgary's day treatment service program. They called me out of the blue just to see if I would present something. And so I spent like 40 hours of time developing this talk. And just because there was psychiatrists there. And so I gave it to them. And then that was back in 2011. And I've just really, how did I meet the psychologists I work with? We've just maybe stumbled across each other. They've called me because they see on my website that I have a focus in anxiety and depression, and then we'll meet. And I've actually gone over this talk with them, so they have an understanding of where I go from a naturopathic perspective. And then I've given this talk to medical doctors, psychologist groups, chiros, massage therapists, osteopaths as well. So just kind of like growing that connection. And like, I am super thankful to be able to work with psychologists because I believe in the work that they do so much that I'm like, oh, thank goodness this person's seeing a therapist, because they need it. And the stuff I'm doing helps, but if they're not doing the therapeutic aspect, they're not going to move those thoughts aspect. So the psychologist and I will talk back and forth as well. So I've set up relationships with psychologists where we will get the client to fill out a reciprocal consent, where basically the top part is allowing me to talk to the psychologist and the psychologist to talk to me. And then the psychologist and I will set up a phone meeting for 15 minutes so they can tell me what they're working on and I can let them know what I'm working on. And then sometimes we'll talk in between visits as well. So does that answer your question?
Excellent. We have just a few more questions. One was for fish oils. Do you liquid or capsule?
I don't have a preference of liquid or capsule. It's more that I'm looking at the EPA and the DHA to make sure that I'm giving them enough EPA. Like I want that EPA to be at 1500 for the inflammation piece. And DHA, I want it to be at like, especially postpartum, like at least 1200, but more like 1800 milligrams is what I find works best. So, but capsule or liquid, like whatever's, and again, it's checking in with the person. Some people are like, oh, please give me capsules because like the idea of fish oil, versus others are like, 4 capsules. No, just give me the teaspoon of liquid. So just kind of depends on the person too.
Yeah, what's going to get them compliant? And then that's answers the second question about postpartum. So that was 1200 to 1800 of the DHA for postpartum?
Yeah, that's what I find works best.
Perfect. And our last question that we'll have time for today is, can you kind of speak to the role of epigenetics and genetics in a lot of these mental health conditions? I know that's a huge topic, but where do you kind of add that piece in? At what point during a course of treatment?
Okay, so here's a big, epigenetics is totally not my forte. So I know a little bit about the COMT, and if that's downregulated, that can actually create more stimulation of B vitamins. But it's not my forte. I actually refer to other colleagues because I work more in anxiety, depression, and I work on women's health, and I know that genetics is a piece. And I like look at the methylation piece on the Dutch labs and the OAT test and that kind of thing, but I have limited information. I can't really give you more than that.
Which I think that in itself is just so important as professionals, is when we know, when to refer out and who is the most appropriate person for that. So yeah, well, thank you so much again. This has been so informative, and even just with the breadth of questions, I think we can tell so many people have taken so much from this. So we appreciate your time. And if anyone does have additional questions, you can email them to marketing@aor.ca. We'll make sure they get to the right place. And for future webinars with AOR, check out aor.ca/webinars with an S. Thank you for taking the time, and have a wonderful rest of your day, everyone. Take care.
Thank you.